my presentation. I wanted to do this on attachment styles and the effects that have on adolescence. The reason for this is because, to me, teenage years are usually very influential in a person's life, and it's also very applicable to me because I work in a residential treatment center for teenage girls. So this is something that I wanted to look more into. So just a quick overview, attachment is a deep emotional bond between two people. This is usually characterized by the behaviors of a child and an adult, which generally tends to be the mother. It also helps them to build social, emotional, and cognitive development in children, and it's often used as a coping mechanism for children because they are able to have someone to turn to and that they can rely on. So the first style that we're going to talk about is secure attachment style. So I just wanted to go over briefly what these attachment styles look like in children and in adults, and then in a minute we'll go over what they look like in teenagers. Just something to keep in mind is that generally the teenagers tend to lean more on the side of the child characteristics than on the adult side of the characteristics. So as a child with secure attachment style, they will go to the parent when they're upset, which again usually tends to be the mother. They will explore when the mom is present, and they explore a little bit less when the mom is away, because they're less comfortable at that point. They also have a little bit of distress when mom usually leaves, and they're happy when the mom returns. As an adult, you can see this as someone being confident. They're usually very positive with themselves, and they have a very positive view of their parents and their relationship with their parents. There's usually a lot more greater satisfaction with their life and with just adjusting to being an adult and handling general life situations. They usually perceive their parents to have happy marriages as well, and they're just generally seen as happy people. Anxious attachment style is usually a little bit more back and forth. The child is very uncertain about a parent, and they tend to be anxious whether the mother is going to be available or the parental figure is going to be available or not. They will act clingy towards their parents when they are available because they don't know how often that's going to be. They don't know when the parents are going to be there for them, and they don't know when they're going to be on their own. So when their parents are there, they are very clingy, and they try and get all their needs met at that point, so that they don't have to worry about it later. And really, this is just the children just don't know how to expect what's going to happen with the parents. They don't know when the parents will be available or when the parents will be ignoring them. So anxious attachment style as an adult is usually showing them being more dependent on others. They often are very afraid of relationships because they're afraid people are going to abandon them, and they usually will use that against people that they're seeing as well. If they're in a romantic relationship, they hold that against their partner because they're afraid that they're going to leave them. They're always afraid people will just give up on them and leave. And they usually perceive their parents as having an unhappy marriage. For me, I've seen this at my treatment center. I used to work with a client who was born in a very anxious attachment style. They tended to be very obsessed with romantic relationships and were very, very hurt by anyone who abandoned them, even if it was for 5 minutes, or whether they wouldn't sit by them, or even if they interacted with a different person other than them. And whenever their parents would come and visit them, they also became very, very clingy to them and would be very dependent on them no matter what it was. They'd expect them to basically take care of everything for them and didn't really trust anyone else. So that's anxious attachment style. The next one is avoidant attachment style. So for this, the child generally is pretty angry and aggressive. They usually will stay away from other people and other children, adults. This is based on when they're younger and the parents will ignore the child's needs. They tend to learn that their adults aren't going to take care of them. They also are usually rejected when they're hurt or sick, and as a result, they usually don't go to anyone when they're feeling a need. and the parents are never emotionally available for them. As an adult, you can see this by the person being very apprehensive about relationships. They want to be close to others, but they often find it very difficult to actually connect with anyone. They don't trust other people based on their childhood of being abandoned and being left alone. And they're also very nervous when they become close to people because they're just afraid of people leaving. And as a result, they don't share their feelings because they don't trust anyone. And it's very hard for them to be vulnerable and to open up. So compared to children and adults, teenagers tend to have a slight change. So as a secure attachment, teenagers usually are less likely to take risks, maybe because they have that connection with people and they don't feel the need to be doing lots of risks to get attention. They also have a lot better social skills because they've had that basic foundation from when they were young. They tend to have less mental health issues and better coping strategies. For anxious attachment, teenagers tend to be afraid to reach out to their parents because they often think that they're going to be punished or they're going to be rejected. If they ever need help from their parents, they will just basically try their hardest, but they don't expect the parents to do anything in return. And so as a result of this, they don't think their parents are interested in them, which makes it very hard for them to build a good relationship with them. An avoidant attachment teenager would be defiant and defensive, which generally is more than the typical teenager. They seem highly independent, even though they are not usually capable of being that independent. They're usually very suspicious of anyone being empathetic or being nice to them, and they're very unwilling to change their ideas when it comes to this. So it's very hard for them to trust people from the beginning. But at this point, when they're teenagers, they also still have the opportunity to build those secure attachments with their parents or with another adult. And they often compare more to the children, but they also tend to form those secure attachments with other people instead of their parents at this point, just because of their growing up and they're trying to be more, less independent on their parents. So often they will build secure attachments with a different adult, maybe a mentor or a teacher, or even someone in their friend group, just as someone to have that secure attachment with. So there's a study that was done in 1997 and 1998. So Cooper, Shaver, and Collins, they were one of the first people to focus their attachment study on things like alcohol abuse, sexual abuse, and other different antisocial behaviors. So it took them over a year to do this, but they interviewed over 2,000 teenagers or adolescents. And they tended to have 2-hour interviews that basically asked them all sorts of questions based on their parents, on how they would attach to different relationships in their lives, whether it was romantic or with their friends or with their parents or siblings. And what they found is that teenagers that are usually more associated with anxious attachment style, they tend to be a lot more depressed than teenagers with avoidant or secure attachment style. And they also tend to be behaving in a hostile manner. So they tend to just have a lot harder time just excelling at most things. They will perform poorly in school, and they tend to engage in sexual relationships at a very young age, especially a young age for 1998. For nowadays, probably not as young of an age. But they also tend to have more social involvement with their peers. Teenagers with avoidant attachment style are actually quite afraid of risky behaviors. This is Cooper, Shaver, and Collins decided it was probably because they were more focused on the rules and they tended to be more risky when they became more independent and much older, more towards like their early 20s and a little bit later on into life. So then there's another study I looked at that's basically looks at how we can build attachment in families at an age of, well, at the teenager's age time. So this is attachment-based family therapy. So it actually was created to focus on children with depression, because there are a lot of different reasons behind teenagers having depression, some of which they looked into are biology, cognitive issues, social skills, parental psychopathology, and environmental stressors. And these all could either contribute to or have a bigger push on their depression. So the first half of this treatment is based on basically helping the adolescents to identify what the conflicts have been within the family over the past several years or so, or certain events that basically broke the relationship and that had an effect on their attachment. The second half of this treatment focuses on promoting the adolescents to do things like school, going to school, improving their grades, finding a job, developing, or even going back to social activities. This focusing on those behaviors would help them to basically to combat negative self-image or reduce isolation, and it would basically help them to go back to normal developmental challenges. And these also would help the child to be able to combat future depression, and to be able to be ready for when anything would come up in their lives later in life. So the 5 tasks of attachment-based family therapy, they're the 5 things that the therapist would generally focus on when they use this style. So the first one would be relational reframing. So they want to be able to improve the family's relationship, because usually at this point the kids are very distant from their parents. They don't want to tell them anything, and the parents are usually very upset with the child's actions, because they're either isolating or they're doing something else that the parents don't agree with. So at this point, the therapist would tend to just focus on how the family can build connections and how they can be able to be on good terms again. The second task would be for the therapist to be able to have a connection with the adolescents. So this would help the therapist be able to understand what the child was going through when they were feeling depressed or while they're feeling depressed. It also helps the therapist to understand the child's goals, whether it's lifelong goals or goals for the treatment or goals to be able to get back in a good relationship with their parents. So they really focus on what the child needs and what the child is looking for and how they can help them personally. The third step is similar, where the therapist would focus on building that connection with the parents. And this is based on who the parents are apart from the child and who the parents are as individuals. They would build this by looking at how the parents were treated by their own parents and how committed they are to be reattached to their child. Basically what all they're going to put into it. They also have to be putting into the work instead of just relying on the child to be able to fix their own problem. So the fourth step is reattachment. So this is one of the most important phases where you're actually building those relationships again. So you're getting over the failures to attach by talking about any issues that would have happened between the family, helping them to work together for a bigger goal, and helping them to know how to communicate in a healthier way so that when things like this come up in the future, that they are ready to go at it as a family and as a team instead of leaving the teenager to deal with it on their own. And then the parents would just worry. So they focus on being together and reattaching so that they have those good relationships. The fifth step would be to promote competency. So this is to help the child to decrease their isolation, and helping them to be able to recognize their own strengths and be able to use them in a real life setting, This also gives the parents different skills to be able to use with their teenagers so that they can handle supporting them and be able to know how to build connections while also being able to hold boundaries with them. And overall, just to make sure that the child knows that the parents are there as a resource and not as just someone who's trying to control their life. So for my multiple choice question, an adult raised in a secure attachment style is most likely to perceive their parents' marriage as A, the perfect marriage, B, a happy marriage, C, a dysfunctional marriage, and D, a unrealistic marriage. So yeah, thank you for watching, and these are my sources.